Hello physios, I welcome you all to our channel Physiovidyapeeth. We are back with our next lecture on cryotherapy or cold therapy. Okay, so it is one of the common and important and it is very basic topic, and we must have in-depth knowledge about this topic so that we are using the cryotherapy efficiently to treat the individuals. Okay, so my name is Vijay Kumar and let's get started. So what is cryotherapy? It is defined as the use of local or general body cooling. There are two terms, either we are using local cooling or general cooling for various therapeutic effects. Yes, now local uses are the uses in which we are using the cold pack. For example, in case of acute injury, for example ankle sprain, okay, or any kind of muscle spasm in which we are using the cold therapy, that is the local use. We are applying the cold pack at a local body part. While general cooling is used in cardiac surgeries and neurosurgeries, and you might be wondering that why is so. Okay, in case of cardiac surgeries or neurosurgeries, it is a long procedure, so the doctors try to reduce the oxygen demand of the body. So according to the Van Hoff law, that is metabolic rate, that is metabolism of body is directly proportional to the temperature. So if body temperature will be high, metabolism will be high, and if body temperature will be low, definitely the metabolism will be low. So to decrease the use of oxygen, they use the general body cooling to maintain the oxygenation in the body for a longer interval, and they can do the surgery in an ease, okay, for a longer period of time. Okay, it is used in the treatment of acute trauma and subacute injuries. Okay, so and various method of application are as followings, and I am using pictures for you. Okay, first is cold pack, second is cold immersion, third is coolant spray or evaporative spray, fourth is ice towels, fifth is ice massage, sixth is cyclotherm or cold compression unit. Okay, and this particularly can provide heating as well as cooling, and I will explain you this part in our upcoming lectures. Now we are more focusing toward what is cooling and what are the factors that are affecting the cooling. So what is cooling? In general, we can say that cooling is defined as the transfer of energy or heat from a body which is at high temperature to a body which is at lower temperature. For example, when we place ice cube on hand, ice slowly start to melt, that is converting into the liquid stage. So what is happening here? Here the energy from the body, that is our hand, is transferring into the ice that is at the lower temperature. So energy transfer take place from higher temperature to lower temperature, due to which the loss of energy occur at the body part from where we are applying the cold pack or ice. So cooling occur. See, when I am placing ice cube on my hand, okay, after some time ice will melt. What is occurring here? The energy from my hand is transferring to the ice cube, due to which ice cube start to melt. Now at our tissue, what is happening? The energy has lost, due to which cooling occurred. Okay, so due to the loss of energy or heat from the body, cooling occur. So it is defined as the transfer of heat from the body at higher temperature to the lower temperature. आइस को हैंड के ऊपर रखा, हीट जो है हैंड से आइस में गई और आइस क्या हो गई? मेल्ट होके क्या बनी? लिक्विड स्टेज। क्या बनी, लिक्विड स्टेज। ओके, सो यहां से एनर्जी लॉस्ट हो गई, सो हमारी बॉडी कूल हो गई, और यहां पर एनर्जी गेन हुई, जिसके चलते स्टेट जो है चेंज हो गई, दैट इज इट कन्वर्टेड इनटू द लिक्विड स्टेज। सो दिस इज व्हाट इज कूलिंग। ओके, सो नेक्स्ट इज फैक्टर अफेक्टिंग, is the factor affecting cooling. Okay, so these are the four factors. First is temperature gradient or temperature difference. Second is thermal conductivity. Third is time, and fourth is area. Okay, so temperature gradient, it is the difference between body temperature and the temperature of coolant, and coolant can be either cold pack or cold immersion or ice towel. That is our method of application. So temperature gradient is equal to temperature of body minus temperature of coolant, and coolant can be different in different cases. So here the body temperature is constant, that is the 37 degree Celsius. Our homeostasis try to maintain our body temperature at 37 degrees Celsius. So the first term is nearly constant. Now if I am saying that temperature gradient is directly proportional to cooling, that is more is the temperature difference, more will be the transfer of energy, and more will be cooling. So this term need to be lowered. For example, there are two individuals, Raman and Raju. Okay, he is also at 37 degrees Celsius, he is also at 37 degrees Celsius. I have two cold pack. This one is at 0 degrees Celsius applied to Raman. This one is at 10 degrees Celsius applied to Raju. So what is the temperature gradient? 37 minus 0, 37. 37 minus 10, 27. So cooling will be more in Raman as compared to Raju. So in temperature gradient you can simply write that it is directly proportional, that is more is the temperature difference, more will be the transfer of energy, that is from high temperature to low temperature, so more will be cooling. So thermal conductivity, it is different in different body tissues. For example, thermal conductivity is more in muscles. In muscles thermal conductivity is high, while in case of skin and subcutaneous tissues thermal conductivity is low. Now what is thermal conductivity? That is also important. It is the ability of the tissue to transfer heat or cooling. Okay, so transferring ability is more in muscles because it has a lot of water in it. So thermal conductivity is high in that tissues which have lot of water content, that is muscles, while less in the tissues which is having less water content, that is skin and subcutaneous tissue. So cooling will be more when we are applying the cold pack at that part which is having a muscular area, that is a muscular area, but it will be slow or time taking when we are applying the cold pack at that area which has a lot of subcutaneous tissue, that is fat around it, because the fat is acting as a insulation. Okay, which will reduce the rate of cooling. Okay, so this is about the thermal conductivity. Next is time. For example, Raman is having a cold pack of 10 minutes while Raju is having a cold pack of 5 minutes. So here the loss of energy will be more. Why? Because cold application is for a longer period of time. So when we are applying the cold pack for a longer period of time, so more loss of energy is occurring from the body to the cold pack. That is, energy is transferring from our body to the coolant, that is either cold pack or cold immersion. So more is the heat loss in the body, more will be cooling. So more time has more energy loss from body, more cooling. So this is also directly प्रोपोर्शनल, कि जब हम ज्यादा टाइम अप्लाई करेंगे तो ज्यादा कूलिंग, कम टाइम अप्लाई करेंगे तो कम कूलिंग होगा. एंड लास्ट इज एरिया. सो दिस इज ऑल्सो क्वाइट इंपॉर्टेंट. फॉर एग्जाम्पल एक इंडिविजुअल है जिसके ऊपर हमने एक आइस क्यूब रखा स्मॉल सा उसके पाम पे, and there is another individual in which we are applying a cold pack which is big, that is on the whole bag. So definitely the cooling will be more, in which more area is involved, because more is the area of cold application, more is the loss of energy. और जैसे ही हमारी पीठ से एनर्जी का लॉस होगा, that is टेम्परेचर का लॉस होगा, heat will be transferred from the skin to the coolant, more will be the cooling. Okay, so area के ऊपर भी ये directly proportional है. Now in this graph you can see the temperature changes with time which is occurring in different tissues. For example, the lowermost curve, that is of the skin. Here initially the temperature was between 25 and 30 degrees Celsius. Okay, it reduced to 5 degrees Celsius. That is, a lot of change has occurred in the temperature of skin. While in subcutaneous tissue you can see that the change is very less. That is, it was between 30 to 35 initially, which reached up to about 20 degree Celsius. While in muscles the initial temperature was about 35 and 40, that is between the 35 and 40, and it reached to about 32 or 33 degrees Celsius. So you can see that most of the temperature change is occurring in skin, then followed by subcutaneous tissue, followed by muscles, and the minimum change is occurring in the muscle, which means that the conduction of the cooling from skin to muscle is low. That is, the thermal conductivity is low in skin and subcutaneous tissue. That is why their temperature change has a drastic change. Okay, so the temperature of skin and subcutaneous tissue is changing very much, that is more drastically in case of skin, but muscle, which is having a high thermal conductivity, is receiving a less amount of cooling, because the thermal conductivity of its upper layer, that is skin and subcutaneous tissue, is less. So in simple words we can say that less amount of conduction occur from skin and subcutaneous tissue to muscle. That is why temperature changes in the muscle, which is the deep tissue, occur less. You can understand this thing in the physiological effect also, where I will be explaining deep tissue blood flow. Okay, so this is about the first lecture of cryotherapy. What you have studied? What is cryotherapy? Important question is where we are using local cooling and where we are using general cooling. You need to remember the use of general cooling in cardiac surgeries and neurosurgeries, and what is the reason to reduce the oxygen demand, according to which law? Van 't Hoff law, and this is asked in Viva. Second is different methods of cold application. These are the most commonly used method. Then what is cooling? How the transfer of energy is occurring? High energy to lower energy, or high temperature to lower temperature. Then factor affecting cooling, that is the gradient, conductivity, time and area. Okay, so with this we are completing this lecture. In our next part we will study about the physiological effects of cryotherapy. So till then you keep on studying. Thank you to one and all.